Yeah.
Hello.
Hello, how are you?
I'm good. How are
Let's have a
you?
coffee
Nice
break.
coffee. I'm having a cup of tea. I've had so much coffee lately.
I see.
Mm.
I love coffee. Different variety of coffee, every corner of the world. And especially when I have the conference in the internationally, I will enjoy the coffee of that specific area, like in Vietnam, in Australia, in the US, in France, is all different.
Oh, it's nice.
So enjoy
Cheers.
the coffee.
Exactly. Cheers.
Cheers.
So for anyone who doesn't know you, can you tell me your name, your work history, and where you're working?
Yes, well, I'm Dr. Sky Wong. I think that some of you, my friends and colleagues and fellows on the screen, will actually know a little bit about me. And I'm a cosmetic surgeon in Hong Kong, and I'm the only one have the determination so that I have the double degree in the aesthetic plastic surgery and practical dermatology. I've been in the field of the aesthetics and medicines for more than 8 years. And I'm very much loving this industry because it is a fast growing, amazing, exciting one. And therefore, I would like to also contribute a little bit on it, like I'm being the course director and also the lecturers for aesthetic medicine in the University of Hong Kong space and other institutes and participate in some of the international conferences. And that's why I've made very good friends around the world. And one of the best friends is actually Danielle.
Seeing as we're in
Yeah.
Hong Kong, I'm going to give you a surprise. So let's have a look.
Yeah.
Here. I'm going to give you a surprise. Here we go.
Whoa, very well, very nice backdrop. And this is exactly the views that I like. This is magnificent, the best way and best time for you to go to the peak and look at this beautiful scenery is exactly in the evening because you can enjoy the sunset and actually you can also enjoy the night scene after the sunset. But of course, your backdrop is the dawn. The dawn, yeah, it's a very good meaning because everyone now is having the light in the end of the tunnel. Everyone is knowing that we are actually going into a very successful fighting of the war against COVID-19. Everything will come back, including our happiness as well as the economy, right?
Exactly.
Yeah.
What's a typical day look like at the moment for you in Hong Kong?
Well, in Hong Kong, because we are quite meticulous about the measures of preventing the transmission of COVID-19, because we have really a very painful experience about SARS, everyone knows, so that we have quite significant lockdown in everything. That's why when you go onto the street 1 week ago, you actually see no one on the street. Everyone is home office, and in the restaurant you don't see anyone. You're really there to go outside for dining. Actually, you have the whole restaurant yourself. So it is a little bit on the sad side. However, with the COVID-19, you know that in the past 15 days, we have 0 case of new confirmations in Hong Kong locally. And that's why I think that we are doing quite a containment job. So we are now gradually actually unfreezing the lockdown. And for my clinic, because we only can provide the essential medical services, like the dermatology that I see the people with the real diseases. And that's how our aesthetic practice has been actually stopped for quite a while, 1 whole month already. Yeah.
What are you looking the most forward to when the restrictions are lifted?
Well, of course, the release of pressure. Everyone is becoming happy, and actually I'm looking forward to on the streets of Hong Kong is again a lot of people crowded. Everyone is happy, the economy is coming back. That is what I believe strongly that will happen in very soon future, but we have to be very cautious because every single step we have made it wrong, then it will be a problem, right? And secondly is actually we have a new reset. And after the reset, we have adopted the new order, then we may have done everything better. Because COVID-19, although it brought about a lot of unhappiness to us, a lot of stress, right? But it also allows us to have a lot of time to rethink the situation and give us this luxury to have time to do something that we don't have the chance to do during our busy life, right? So what we have now is actually resetting our mindset. For me, I've retrained my team, my medical team, and I've also think of new strategy or what new services that I should provide to our patient after the lifting of the COVID-19 limitations. And I am hoping that in a few weeks later, we'll have a new life, new approach, and everyone will enjoy and being happy.
How have you been able to interact with your patients during this time?
During the COVID-19?
Yeah.
Well, actually, you know, everyone know that everywhere is locked down. We can actually do some online consultation for the patient for really urgent kind of matters. And if they really have the medical problem, of course, they will come. That is the normal one. But one important point is that during the COVID-19, we have to maintain our team circle. What means by team circle is including myself, my staff. That's why I need to do continuous training and think of new strategy and business models. And secondly, very importantly, the circle includes your clients. And the client says if you interacting with them, I will actually, because they cannot come for the services, I will actually provide concern to my patients. I'm not necessarily really have them to come into my clinic and do my service and pay money to me. No, because they are all my friends. So during this hard time, they all need concerns. So we will actually use our heart from the bottom of our heart and give them concerns and also provide them adequate information of how to fight against the COVID-19, like how to be a very good circuit breaker to eliminate the transmission line, how to do the personal hygiene well, what has to be focus on when you are doing the preventive measures, know about, the COVID-19 can last for a long time on the material surfaces, then we will advise them how to clean the environment, etc. and etc. And they feel all happy. And once they get the information, they remember you, they know your concerns, they are being one of the team member of your team circle. So when the COVID-19 things has gone, they will remember you and come to you happily. Okay, so that's why I think that this is a double benefit for all of us during this time to interact with our patients.
That's kind of you. You're so kind. So let's talk about Cutera. So what systems do you have of Cuteras in your clinic?
Well, my clinic has quite a lot of Cutera gadgets, machines, wonderful things. And just to name a few, I've got, this is really the hero, the picosecond laser. And this addition is the Enlighten 3 that I've got the 670 wavelength, which is a lovely wavelength that I've always been saying about that. I've been publishing a review for the picosecond laser, and I've significantly spent a lot of effort in explaining how good a 670 picosecond laser is. And moreover, I've got another hero. I love that XLV. Okay, it is very good gadget, and actually when it is combined with the picosecond laser, it is second to none for the effect. Okay, and I'm expecting the XLV Plus as well. And now I'm enjoying in training my muscles and body shape, and that's how I have my flares. This is the true skull flares. I know that now you have got one at your home. That is what I envy you so much. Because every time when I need to train up my muscle, I need to go back to my clinic, but you can do it at your home. What a pity.
Just for the moment before they take it away from me, but it's fantastic.
Yeah.
I love it. It's so amazing and so easy, and I'm going to look so good, Sky. I'm going to look so good when this is all over.
Yeah, I love to show you something after in the later part of our conversation.
Okay. So out of all of those, do you have a particular favorite, or just all of them in general?
I think combination is really a key word for us in the aesthetic medicine practice, because everything has a lot of different root causes. For example, for the melasma, okay, we don't actually only need to blast away the pigment. We have to also treat about the the vasculopathy related to the melasma. Then and only then you have a more sustained and quick response for the treatment of pigment. And that's why at that case, I have a jargon to have the double genesis. It means that I've got my pico for the picogenesis, and I have got my XLV for my laser genesis. Both of them, when combined together, we can gently blast away the vasculopathy, the vascular component, and blast away the melasma pigment. At the same time, we can actually enjoy the revitalization with the new collagenesis. So everything is becoming very well, very good, and you can achieve the obvious results in 2 to 3 times sometimes. So it is an excellent one. So when you ask me if there is any ultimate hero, no, because every single pieces of them is actually a hero. They are actually a good team, the team of the wonderful consoles.
How much of a combination laser genesis, picogenesis do you think you do every week?
Well, every week, I think that it is around about 100 numbers. Yeah, around about 100, because I've got my lovely therapists, nurses, teammates at that, and actually for myself, I'm doing more than 50 a week. So in combination of the two, these two are very busy workhorses, really busy workhorses, and delivering very good results. So yeah, it is a really high flows demand for both of the machines.
So when you first got the systems, because they were new to your practice, how did you market them?
Well, actually, we have several levels of marketing. First of all, I think B2C is very important. It means the business to client marketing, because we have to create a demand, or we have to let our end user knows that it is a wonderful gadgets and treatment, so that they can enjoy the results outcome. And that's why I've done quite a lot of times of some educations about the patients. For example, again, melasma, we would like to do a very good laser for the pigment as well as the vasculopathy at the same time. And then we know that these two, the Pico and the XLV, are very good quality machines. So we will tell them these are the choices you have. Okay, and for this education, we will have it on the website, on the Facebook, and all of the social media, in order to let them know the conditions of our concepts. And it is a very good one. And secondly, we will also develop word of mouth. And word of mouth cannot be developed unless you really have a very good machines and deliver very wonderful results, isn't it? Otherwise, when the people have done the things that they feel that the outcome is not right, and they would not speak for you, right? And this is how a word of mouth doing. And for our practice, because doctors do not really want to do a lot of advertisement, and that's how we would like and love to have the word of mouth, because when they have the word of mouth, they actually agree on your ability and your quality of service. And quite quite a lot of time, we are having new customers from the friend get friends, members get members. They introduce their friends for our center for the treatment. So these are the main marketing methods or way of the introducing our service to the others. Yep.
That's nice. If someone was interested in getting into lasers or technology in their practice, what would you suggest would be a wonderful product to start with?
Well, I think that really Pico and XLV, and that's actually I'm keeping again and again talking about that because what we have in our skin aging, we have to know about the skin aging, right? Just for skin aging, we are dealing with the pigmentary problem, and there's actually two pigmentary problems that we have really a big problem in our customer is actually the blind pigment, that is the melanin problem. And secondly, it is the redness problem, that is the vascular problem. So for these two problems, we have got the Pico laser as well as the XRV. This is first. And secondly, tattoo, right? Tattoo is actually having a quite a widespread problem in our global population. So this is not only in Australia, not only in the US, it's also in the Oriental, the Asian populations. We do a lot of tattoo, surprisingly, okay? And actually, quite a lot of them, more than half of them regress after the tattoo because of various reasons. For example, the tattoo is out of fashions. They change the girlfriends from Daisy to Danielle, okay, something like that. So it is really a big market. So you got the Pico, then you can deal with that. And moreover, the third thing is rejuvenation. Okay, for rejuvenation, you can use the XLV for the rebuilding the collagen because you are having a very effective way and gentle, I say it's a hot stone massage therapy in which you are feeling very comfortable, and then you have your collagen building up. And you can also all the way have a newer concept of using the MLA for doing the LIOB. For the LIOB, is not only the new collagen, and I realized that it will actually do a lot of good things and good effects for the atrophic scars. Okay, because it is not only LIOB, it is LIOB substitutions. How it is done, we have the webinar later, right, in the late May. So everyone stay tuned. I will explain a little bit on the concept of what means by LIOB substitution. And apart from the substitution, we also have the plasma ablation resurfacing effects by using the MLA. So this is really a revolutionary concepts and technology. And with these two gadgets, you can replace a lot of different consoles, okay? So you can blast away the pigment, improve the redness, increase the collagen, and also revitalize your skin in various methods. You don't need any something like fractal, you don't need the other IPL kinds of things. These two gadgets to start with, you can actually manage 98% of your clients. Yeah.
That's fantastic. I can't wait for the webinar. It's going to be wonderful, and we'll make sure everyone knows about it and they can all attend, and we're going to have a great day.
Yeah.
So I know in that very limited amount of spare time that you have, you like to run. You like to run.
Yeah, I love it.
And I think your results from running and doing the flex, I've seen them, they're amazing.
Yes, actually, you know that during the COVID-19, well, the gyms are locked down, okay? I cannot do anything, so I'm thinking of what I can work out because I love working out, and I actually gained an enormous amount of weight during the COVID-19. And I think this is one of the problem of everyone. by the screen and your friend, right? Because you are not allowed to go to the gym. You are having a stagnant life. You're eating a lot. Home office, you're sitting. Then you are accumulating your energy and fats, right? So that's how I actually do a lot of active and passive training. Because for the training, we know that it's not only train, okay? In the past, I actually do a lot of gyms. However, I still cannot really train up my six pack. I think that my muscle is still taking a long time of curve in order to achieve a very good result. And after I get into the flash, it was amazing because I can actually shorten the training durations and also get the results way much faster than before. And you know what? I would like to show you something.
Yeah, please.
Yes, share the screen. Can you see that?
I can.
Can, right?
You?
So you can see that is me. So you can actually realize the time, the date. It was 21st of February. I was quite a fat boy, right? So the waist is very wide, and I think within 2 months, it is less than 2 months. Can you see that?
You look fantastic. It looks amazing.
Yes, really fantastic. And actually now I've got my six pack already. And you know that it is not only the shape, it is not only what we say the AB line, the vest line, the mermaid line. Actually the performance has also improved because no matter how I train up myself, okay, no matter how I train myself in the past, I only can actually do my low planking on the soft mat for only 2.5 minutes. Okay, so without any additional training, I just use the true scalp press, the scalp mode, then actually I can achieve 4.5 minutes.
Oh, double. Wonderful.
Okay. Yeah, it's double, and it's not so easy to have the low planking on a soft mat for such a long time for me in the past. And actually, at the time of the 30 seconds, then I actually know that I still have the room to go for more. Yeah. So that is actually the wonderful concept of the active and passive training. Active is something that you have the weight bearing, you have the resistance, so you are training the quality of muscle. And for the passive one, is something like the physiotherapeutic one, that you train your muscle by recruiting 100% quantitatively of your muscle to do the work. So at the same time, when you do the active and passive interchangeably, you have the quantity and quality. And for the flash, it is different from the usual EM wave training. I think that the contraction is much more intense, so that the resistance is being made artificially is way much higher than the other technology. And that's why I really have the natural tearing of my muscle, a little bit of muscle aching, and then I think it is both passive and active training as well. So it is really a wonderful gadget. I do it every week.
I think it's fantastic because the gyms are going to be one of the last things to open when the restrictions are.
Yeah, exactly. So, and it's very difficult.
Yeah.
And even though I actually got my, you see, I got my wages here, but still it is not optimal because I only can use some of the very primitive way of training up my muscle. It is very different from what I'm doing in the gym. Okay, so I think that really flash give me a lot of happiness during the COVID-19 period.
Who do you admire from this industry? Anyone in particular? Many people around the world, locally?
Well, everyone in the world that I'm attending the conference, I really miss Australia as well.
Oh,
I really miss you to meet you face to face. Maybe with sometimes I can come all the way again to Australia and meet the friends there. Really lovely because I love the place of Australia. I love Australian. I've got a lot of Australian friends. Hello there. So I'm eager to meet you all up after the COVID-19 and somewhere sometimes in Australia.
yeah, me too. I wish to come to Hong Kong too. I miss you.
Yeah.
So, is there anything in this industry from estheticians or doctors that really annoys you?
Well, actually, there is no, because everyone, I think that's they're my friends. There's no one is going to annoy me, but a lot of them is actually making me very happy because I am someone who is willing to talk with people and also share with people. And my friends, being in my circle of friends, they are all lovely people, including the people in the Malaysia, like Tin Song, huh? In the Thai, like Professor Warfong, Professor Rashima, and a lot of people in Australia and also in the Singapore, in Australasian area. Everyone's are lovely. I love them, and that's why I'm looking forward to meet them. None of them is actually making me annoyed.
So, when
Yeah.
you reopen, aesthetically, okay, are there any specific ideas you have to boost business or, make sure things are on track fast?
Well, actually, because during the COVID-19, we have lockdown for the aesthetic services, and that's how we have a lot of time. Therefore, we actually train up our team about the technique, the small steps about our services, and then I'm actually looking for that even though the same service, if you have improvement on a very tiny bit of delicate steps, then give your patients entirely new refreshing feeling. And this is one. And secondly is that I think that really in during my practice, I really find that the pigment management is one of the good things that if you do it right, you know how is the outcome. And the second thing is actually body slimming. Because before the COVID-19, we are only thinking of getting into the slimming industry. And now we are actually deploying the new service about the body contouring. And we have different levels of doing the body contouring, that we have the dietary advice lifestyle modifications. We do have the supplements, functional and integrated medicine for controlling the weight and some of the prescription drugs because we are doctors. And then this are actually the basic one. And then we will do quite a lot of the muscle training. Because if you want to have a very good body sculpturing, you need to really have very good muscle and good proportion of muscle to fat ratio, okay? And that's how we have get in the Cutera True Cut Fresh, which is amazing. And we do also have the like the cryolipolysis kind of things. All these kind of things are being well installed in my clinic and center, and my team is all well trained, and all the patient is now getting better, and that's why how they need the help. And then we are going to provide the help, and this is one of the main things that I am expecting it will do quite a good results and good satisfaction to our patients after the COVID-19 lockdown.
Is there any support that you would like from me or Cutera at the moment, or specifically when you reopen?
Well, I think that first of all, you have already done a very good job because you all provide a very wonderful machines and products, and your team support for Cutera, I undoubtedly admit that is wonderful, very supportive. And I think that you have also done something very good, is that you have some of the circles of the customers, circles of the people who have already bought the Cutera machines. You make the your doctors clients and physicians clients as a supporting group of each other to share their ideas and their experience. That's very important. And of course, I think that the Cutera has also done a lot of R&D, developing very good protocols. And doing so, we know that the curve of learning the experience and learning the errors is much shortened. So all of you are actually doing a very good job. So what you need to do is actually to continue the wonderful job you are doing. Then will be good enough. Yeah.
You're so kind. Is
Yeah.
there anything you would like to say to your clients or the industry at the moment?
Well, I think that yes, every one of us are very unhappy, very depressed about the COVID-19, but we are seeing the light from the other of the tunnel. It's not far away, and we all of us getting hope. If we have the faith and getting to survive in this period, we will be the winner. And really remember that this kind of period is just a temporary period. It has to be, it will be going away very quickly with our efforts. However, we should not be too, I mean that we should not be really too comfortable about the improving situation. We still have to very cautious about the situation, because if we don't do the things right, a small step can actually make the game going back and loop forever. That's why we have the hope. We are going to fight against the war with the beautiful winning, but we have to do it very cautiously. And the economy happiness will come back very quickly. Just like Hong Kong, we're having, saying again, 15 days of zero local new confirmed case. So I think that this will also happen in every corner of the world, including, I think, Australia is really doing a very good job, because you can see the numbers. It's wonderful, right? And I think that Taiwan is another place that is doing quite well. So I think the whole world will be following this trend, and everyone will be getting rid of the disease and the shadow of COVID-19, and everything will come back again. So have faith, be happy, the things will go away very soon. Yeah.
Okay, just to finish off before we have to go, you know any funny jokes? Are you a joke teller?
Well, joke, I'm not very good at joking, but I just would like to ask you some questions, okay? So there's once upon a time someone who asked me, why is a sailor, okay? It's always very difficult to learn the alphabet from A to Z. Do you know why? You don't know?
I don't know.
Really? You know the sailor where they are working on a ship, right?
No.
They're always working on a ship and stuck on the sea. So they stop at the sea, so they cannot learn beyond the sea. So they never do it on sea. And there's actually second question I would like to ask. Do you know why? For my patients, I always can deliver good result to them. No, because I start from C for Cutera. Yeah. Yeah, I like Cutera. Yeah.
You're fantastic. It's so good to see you.
Yeah, so good to see you.
Me.
Thank you very much, and thanks for the invitation for this wonderful coffee break.
I miss you and I'll see you soon.
Yeah, me too. See you all soon. Okay, see you. Bye-bye.
Bye.